Hi, the term I got this week was response blocking. Response blocking is when a learner begins to emit a problem behavior, the therapist physically intervenes to prevent or block the completion of the response. Response blocking is most effective in reducing the frequency of some problem behaviors like self-injurious behaviors, which include things like pica, eye poking, chronic hand mouthing. It can also include self-stimulatory behaviors, which is described in the text as behaviors that are maintained by automatic reinforcement from sensory stimuli produced by the response. It's important to note that response blocking can reduce behavior through extinction or punishment. To paraphrase from the textbook, if all responses are blocked, no more reinforcement in the form of sensory stimuli that could function as an extinction schedule or as a continuous FR1 punishment. So all responses are followed by a physical contact. If only some responses are blocked, then an intermittent schedule would result in varying rates of behavior. Response blocking doesn't happen before the response is emitted. That would be an antecedent intervention. And this is the part that tripped me up a little bit. Okay, because the goal of applied behavior analysis is to aid in an individual's development of socially significant behaviors, it's fair to assume that at some point we may encounter a form of self-injurious behavior, or SIB. Response blocking should be used with careful consideration, as it's known to be met with resistance and combativeness. It should be done with the least amount of physical contact, and it can be paired or prompted with a reprimand. So here's some examples I came up with, keeping in mind that you don't use response blocking before the response is emitted, because that would be something else. So the first example is if a child frequently brings their forearm to their mouth and proceeds to bite or suck the arm, you would do the following. You would say stop and lower the arm only once the child's mouth is open and the arm is bent towards the mouth to bite. You would have to have some cues that biting or sucking was going to happen. If you were to implement alternative behavior, you could provide an object that is safe to bite instead. And my second example is if a man routinely bangs his head against walls, you could say that's not safe, and you could place a cushion, an actual cushion or something, your hand, between his head and the wall to block dangerous contact between his head and the surface. But you wouldn't prevent the banging. You would just be changing it by not making it painful or dangerous. And so that is response blocking.